Lia Bernardi. I'm one of the reproductive endocrinologists at Northwestern Medicine. I see patients in our clinic for a variety of different indications, and certainly I see fertility patients, but one of my passions is recurrent pregnancy loss, and we began a recurrent pregnancy loss clinic a few years ago, and it's a fantastic place to be able to take care of patients who don't necessarily have infertility, but need our services for their history of miscarriages. What we do here at Northwestern Medicine that's really unique to the RPL patient population is that we have a whole team to take care of the folks that we are seeing. And I think a really integral part of that is our psychologist, Dr. Clock, who sees all these patients in tandem with Dr. Pavone and I. This can be extremely emotionally challenging for our patients, and I think having that psychological support is really necessary. And so I think that's honestly the biggest component of what makes us unique. We also have a whole team of support staff that is really comfortable taking care of this patient population, is really empathetic, and understands what they're going through. RPL is defined as 2 or more pregnancy losses. Historically, women weren't evaluated until they had 3 or more, generally consecutive miscarriages. And really the data suggests that we don't need to wait until the 3rd loss to do an RPL evaluation. So when I think about causes of recurrent pregnancy loss, I like to break it into 5 categories. So those causes are something genetic, like a parental balance translocation is something we want to make sure we're ruling out. Something anatomic, either a congenital anomaly of the uterus, something that's developed along the way, or something that's a consequence of a previous miscarriage, like Asherman's, for instance. We want to make sure we're evaluating for antiphospholipid antibody syndrome, which is a known cause of recurrent pregnancy loss, of course. We want to assess hormonal causes of recurrent pregnancy loss, as these can potentially be at play in some individuals. And then we want to look for chronic endometritis, which is something that we find about 30% of the time in our patients with recurrent pregnancy loss. My typical evaluation for RPL includes an assessment of genetics, so doing parental karyotypes for both the male and the female partner. I always want to do an anatomic evaluation. Generally, that will include either a saline ultrasound in the office or sometimes a hysteroscopy if patients desire to go right to that route from the get-go. We evaluate for antiphospholipid antibody syndrome. We do a hormonal evaluation, which usually involves looking at TSH, prolactin, hemoglobin A1C, and vitamin D. And then we generally will do an endometrial biopsy to look for chronic endometritis and ensure that that is not present as patients prepare for their next pregnancy. Our goals in terms of taking care of patients within our recurrent pregnancy loss clinic are to provide really a multidisciplinary, kind of wholehearted ability to take care of them. We try to make it really personalized. Everyone with recurrent pregnancy loss has a slightly different story. It's not a one-size-fits-all approach in terms of the evaluation or the treatment, and so we really try to kind of personalize what we're going to do moving forward based on where they've been, what they want to do, and obviously their ultimate end goals. There aren't that many clinics throughout the country that specialize in this, and I think it can be confusing for OBGYNs or other providers who take care of women who have miscarriages to know where to send these folks and where they can kind of get all the evaluation that makes the most sense from an evidence-based perspective. So I just felt there was a real need to have a place to send these patients where they could get good medical care, get good psychological care, and really feel like they are in the best place they can be. We have ongoing research that patients can become involved with if they want to. One of them is a study that we're doing collaboratively with Dr. Clock, our psychologist, really assessing psychological factors related to recurrent pregnancy loss in both females and males. So we're assessing along the way throughout their journey how men and women are doing from a psychological perspective. Another study that I have ongoing right now is looking at chronic endometritis in folks with recurrent pregnancy loss. This is something that is not particularly well studied. The data is sort of limited, and it's something that I feel should be a part of the standard ASRM evaluation for recurrent pregnancy loss, and it isn't quite yet. So we're trying to gather our own data to kind of demonstrate that this is a really integral part of the evaluation for recurrent pregnancy loss. It's important to just know that we are available. We want to be taking care of these patients. We want to be supporting physicians who have patients with recurrent pregnancy loss. We want to be supporting the patients that have recurrent pregnancy loss. Our goal is to work together as a team and just get to the end goal, which is a healthy baby. And so we want our colleagues to know that we are available, we are here, we are happy to help, and we can be reached out to at any time to talk through patients or to take care of patients or whatever would be helpful in order to get the best outcome possible.